This past fall, the Arkansas Department of Health declared a mumps outbreak on the University of Arkansas campus. According to the Pat Walker Health Center's website, 38 cases were identified. You might be asking yourself, isn't mumps a preventable disease? The answer is yes, through vaccination. However, 407 of the 25,000 students who attend our university failed to receive both of their required MMR vaccines. In the midst of this ongoing COVID-19 pandemic, we don't have a choice whether or not to protect ourselves via vaccination. It could be up to a year before testing is even complete. However, we do have a say when it comes to other dangerous and potentially deadly diseases such as the mumps, and it's our duty to society's safety to say yes to vaccines. With the vaccination debate in mind, it's now time to take matters into our own hands. Vaccine hesitancy has been around ever since the creation of the vaccine, and it's present in 90% of the world's countries. In fact, most of these countries have vaccine exemption laws based on personal or religious beliefs. This is the case in the US as well. As you can see, all of the states in blue have some sort of vaccine exemption law, and the states in white do not, which is only about 5 on my count on the entire map. So more likely than not, you are sending your child to a school in a state where some of the children may not be vaccinated, which could put your child at risk. You might be asking yourself, why are people so hesitant to receive vaccines? Well, according to Dr. V. Carreri's Research for Health Economics in 2019, the spread of fake news and misinformation on social media is blamed as a primary cause of vaccine hesitancy. One of the biggest examples of this is in 1998, Dr. A. Wakefield published a study in The Lancet suggesting a link between the MMR vaccine and autism. This sparked an outrage in the public and made them question vaccine safety. However, the study was retracted by The Lancet in February 2010 for falsified data. A report by the British Medical Journal also came out in 2010 titled Secrets of the MMR Scare and called Wakefield's study irresponsible, dishonest, and the data bogus. But this didn't change the fact that people questioned vaccines, and even though the data was falsified, they still believed it. For example, celebrity Jenny McCarthy blamed her son's autism on vaccination, which further outraged the media and the public. You can see her pictured here with her son on the cover of People magazine, and here's Dr. Wakefield here protesting in New York and further protests in DC. Refusal to vaccinate is a very serious problem and is greater than just the individual. According to the World Health Organization, they named vaccine hesitancy as one of the top 10 greatest health threats in 2019. For example, according to the CDC, 1.5 million people die from vaccine-preventable diseases every single year. The only disease to ever be eradicated completely from the planet is smallpox. According to the CDC, measles was considered eradicated in 2000. This is because of vaccination. However, refusing to vaccinate has led to its reoccurrence. In 2019, 1,282 cases were reported in 31 states, 128 were hospitalized, and 61 developed further complications. As you can see here, in 2010, there were only 63 cases, and it continues to spike and lower until you finally hit 2019, and it just spikes all the way up to 1,282 because people are refusing to vaccinate. People who choose not to vaccinate put not only their children but others at risk. For example, you have people who have weakened immune systems, such as infants or the elderly, or people who can't receive vaccines at all, such as cancer patients. To put this in perspective, an infant can receive their first whooping cough and measles vaccine at 1 year. So that whole first year of their life, they are exposed to many dangerous diseases that can lead to serious complications. These are just a few examples of those. You have a baby with rubella, a baby with measles, and whooping cough, and this can lead to devastating effects. I'm not here to tell you these things to scare you, but to bring awareness to an issue that many don't think apply to them. The solution is simple. Get yourself, friends, and family vaccinated. Most childhood vaccines are 90 to 99% effective, and they're among the safest medical practices that exist. It's easy to stay up to date on all of your vaccines while saving you time and money. It's important to keep yourself organized and informed. You can ask your doctor's office if they can send you your vaccination records, and you always need to stay up to date on the latest medicine. To do this, you can download the CDC's app, which can be a great tool for you and your doctor to keep all of your vaccination records in one place, and you're able to see what you need or your child needs and when. And this right here is just an example of a vaccination record that you can keep and also give to schools or daycares or other places that may require them. Vaccines also cost less time and money than infectious diseases would cost for time off work to care for a child or medical expenses. According to a 2012 study done by the CDC, children under 5 with the flu cost their parents an average of 11 to 73 hours of wages, which can be up to $1,456 total dollars and $300 to $4,000 in medical expenses. Even though vaccines can seem scary and very expensive, under the Patient Protection Act or the Affordable Care Act, many vaccines are available to children and adults without copay. It can be hard to make such drastic changes, but together we can make a difference and reach a 100% vaccination rate. So with this new information I presented to you, we can go out and share this knowledge to better protect our community. You now know that failing to vaccinate is a serious problem and can cause unnecessary outbreaks and preventable diseases that can even lead to death. Moms should have never been present on our campus. We must not keep this vital information to ourselves, but go out and share it with others. The anti-vaccination movement is a threat to global health and is a regression of modern medicine. Its premises rely on misinformation put forth by the media. You now know the full medical truth. For this reason, I urge you to make sure that you, your friends, and your family make vaccination a priority. You can save lives.